Hi, I'm Carol. I'm a registered nurse and I work in a hospital. And one of the most important questions that we ask our patients during the admission process is if they have had their influenza, or commonly known as the flu vaccination. Sadly, the majority of them say no, or no, I don't want it. So today I will be persuading you about the importance of getting your annual flu vaccination. Also, we'll be going over the misconceptions that the public has about the flu vaccination and some education related to it. So to begin with, the Centers for Disease Control and Prevention, the CDC, state that in 2015, only 39% of Americans received the flu vaccination, and over 200,000 were hospitalized because of the flu. So when people don't get vaccinated, the flu spreads through the community. Since we have learned about the low portion of Americans getting vaccinated, let's go over some of the misconceptions. The first misconception is they ask, can I get the flu from getting the vaccination? No. The flu vaccine is inactivated, so it means it's not infectious. The second misconception is, do I really need to get the flu vaccination yearly? Yes, because when you get the vaccination, it will only stay or linger in your body for a certain amount of time, and then it dissipates. So you do need to get a yearly vaccination. The third misconception is, what about the people that get the vaccination and then right away they get sick or flu-like symptoms? The CDC states there's 4 reasons for this to occur. The first reason is that the person has respiratory problems, infection that has similar symptoms as the flu, but it is not the flu. The second reason is that the person gets a vaccine that covers certain flus, and then they come in contact with a virus that is not covered by the vaccine they received. The third reason is that the people get exposed to the virus that have weakened immune systems or chronic health problems that make them just more susceptible to getting the flu. And then the final reason is that when you do get the vaccination, that it's only, there's a 2-week period for it to develop in your body to make you immune. All right, and then lastly, the last misconception is, are there really benefits to getting the annual flu vaccination? Yes. It protects you from getting the flu. If you do get the flu, you usually have milder symptoms. It helps not spread through the community, especially with the immune weakened majority of the older people are very susceptible. And then it can reduce the outcomes that may require hospitalization. So we've learned about the misconceptions and answered them. And now let's move on to educating the public about the importance of getting annual flu vaccinations. According to Davis and Stopler, much of the illness and death caused by conventional or seasonal influenza can be prevented by the annual influenza vaccination. The CDC data shows that people are more likely to get the flu vaccination if their healthcare providers recommend it. If you get the flu vaccination, this can help reduce illness, doctor's visits, missed work because of the flu, and flu-related hospitalization. Also, because the vaccination declines in your system, you need to get it annually because it's just important. And then lastly, in closing, let's review what we've learned. We've learned that the American population, only 39% in 2015 got vaccinated. So we need to get vaccinated. It's important. We've learned about the misconceptions and answered the questions toward them. With our new knowledge and understanding about the importance of flu vaccination, let's be proactive. Let's protect ourselves and protect our loved ones in our community. Let's get our calendar out for 2017 and write on October 1st, vaccination due now. Let's be proactive. Thank you.